Thank you for joining us. I'm Naiba Reynoso. Ahead, Los Angeles County increases crucial funding to help those who suddenly suffer a stroke. And a major donation promises to help keep low-income families stocked with supplies. But first, more COVID-19 tests could soon be in LA County as they receive emergency use authorization from the FDA. Here's a look inside the public health testing lab.
We've been working hard to transition to a higher throughput kind of platform. Fortunately, we've been able to add Panther Fusion instrument that is able to test about 500 tests in 8 hours. So it really has made a big improvement. We constantly try to adapt to the technology. I think it's very important because there's better methods out there. And now, given the fact that consumables are hard to come by, we have different methods at our disposal. So in case we run into issues with instrumentation, we have another technology that we can use. If we have issues with those reagents, we can quickly redirect our staff to other technologies to be able to provide results to our providers without interruption. Now with COVID-19, we're going to also be introducing sequencing technology to evaluate our samples and have a better understanding of the virus. I'm very proud of the way that the laboratory has responded. I think that is very admirable, how they adapted so quickly, and the level of expertise that they developed so quickly is very impressive.
The UCLA Mobile Stroke Unit provides rapid response in LA County for those who suffer a sudden stroke. The Board of Supervisors recently approved an additional $1.4 million of funding to keep the unit active through the next year.
So many people experience strokes, and we want to do the best we can to respond to them.
For every minute that we have a lack of blood flow to the brain, there are 2 million brain cells that die. And so the faster we treat patients, the faster we diagnose them, the more likely they are to have a good clinical outcome. And that's what we strive for.
The longer they're on the road and the longer they're saving lives and helping people, that's important data that we will use long-term to expand this program.
We're also doing a very important project of sophisticated geospatial mapping to see how many units we need to put across the county. Where are the strokes occurring? What time the strokes are occurring? What's the traffic pattern? What are the patients' access to hospital care? And I think we're going to start to see more and more specialized care come for patients to the field rather than waiting and having the time saving before the patients come to the hospital setting. Not only are these units getting to patients faster, but that makes a big difference for patient care.
Before I had an opportunity to panic, I picked up and called 911, and God bless them, the Torrance Fire Department was there within 2 minutes at the max. They started immediately assessing the situation, and right behind them, up comes the stroke unit. Fortunately, it was not a stroke, but it did have the indicia of a stroke.
When my dad started the paramedic program in 1970, it was just for LA County. But now we know it is worldwide, and I think this has the same future.
Looking to beat the heat and get some exercise? Come out to a county park for Parks After Dark in Motion.
We're here at Athens Park enjoying Pad in Motion. LA County Parks and Recreation, with support from DPSS and the Department of Probation, have closed down the streets adjacent to our parks at 10 locations to allow the public to come out and walk, ride their bikes, get on their skateboard, or come out and push the baby cart.
I'm enjoying the walk. I'm enjoying to get out the house, to get a little exercise, to get my heart rate up and pumping. I'm enjoying the people. I'm getting to meet people. LA County, thank you.
For more information about Pad in Motion, go to our website, www.parks.lacounty.gov. See you here.
Families in search of help purchasing necessities like diapers, formula, and wipes are getting a little relief after a $1 million donation to Baby to Baby.
We have so many people that have cooperated with us even today to put this together to help distribute baby items. We gave a check for $1 million to Baby to Baby that's going to be providing that funding for baby formula. And as you know, going into the grocery stores, those are the hot items. Sometimes mothers and families go in and there's nothing left on the shelf.
When we can provide formula or diapers to these children, the parents can focus on putting food on the table, paying their rent, and keeping their children safe during this worldwide pandemic.
Not working right now, it's a big help to receive diapers. Since he's 8 months, he uses a lot of diapers, so just very thankful and grateful.
To call the county 211, and they can also find out where our food banks are being hosted, because similarly when we have our food banks, we typically have diapers and wipes available, and now we'll be able to have formula. It does feel good that you're able to help somebody out who's struggling right now, and that's the purpose of what the county board and many of us are trying to provide to our residents, especially in low-income areas and where the pandemic has hit really hard.
The Curtis Tucker Health Center in South Los Angeles recently went under an extensive makeover. Take a look.
1, 2, and 3. There we go. In the face of COVID-19, to have an integrated facility with public health, mental health, and with health services, this is what needs to happen in terms of state-of-the-art innovation. The patients and the employees who use this facility, utilize this facility, are just going to be over the moon about how much improvement has been wrought.
It went from being really a quite old facility that wasn't conducive to patient care to now being bright with new landscaping, new facade on the outside, and more importantly inside there's been a renovation of both the patient care areas as well as the waiting areas and the registration areas, and the addition of a new community room.
Big shout out to all the departments who made it happen. Big cheer to the constituents, to the clients, to the patients who will benefit from the new Curtis Tucker Center right here in Inglewood.
Got 60 seconds? Meet Rudika Kumar. She's a health educator with the Department of Public Health, working on the front lines as a contact tracer to stop COVID-19 in its tracks.
My name is Rudika Kumar. I'm a senior health educator at the Department of Public Health. Since March of 2020, we've all become disaster health workers. So we do case interviews and contact tracing. It's calling up people who have tested positive and to find out who else has been exposed. And the reason we do that is to connect all the people who have been exposed and then draw a ring around it and make sure that that infection is curbed. The information that we receive from our cases or our contacts is absolutely confidential. That information is not shared with your employer, not shared with even family members. So my job as a senior health educator is to teach, to empower, and then from that empowerment, you get great decisions.
Thanks for joining us. As a reminder that the COVID-19 pandemic is still a threat, meet 30-year-old Javier Gutierrez. He became infected with COVID-19 at a family gathering, and it soon spread to his wife and baby. We'll see you next time on LA County Close Up.
My name is Javier Gutierrez. I'm 30 years old, and I had COVID. I got COVID because of my dad. He went to work, and then he catched it a week after he started working. So we didn't know, he didn't know. My wife and the baby, they had fever like for 3-4 days and cough, like no other cough, undescribable. I was kind of sad. We thought the worst. We never thought this would happen to us, and it did. I was hospitalized 5 days. 5 days fever, like the worst fever I ever had, and 2 days with cough, and then the symptom was chest pain, like if somebody was like on top of my chest. I want the dads to actually take care of their kids, their families. I bought masks for everybody in the house. We gotta follow the rules, you know, we gotta wash our hands, wear the mask, and have the social distancing.